you own a dental practice and you're not making $500,000 a year in income, you're cutting yourself. Most practice owners think that they have to do more of everything. This is completely wrong. Clinical hours per week, earning almost $1 million a year in income. My stress went down, not up. If you collect 1.25 million, so about 100,000 a month, at 60% overhead, that's million in profit. This is not a fantasy. This isn't a unicorn practice. When you don't identify and zero in on your bottleneck, you dilute your effort, and diluted effort gets diluted results. $500,000 income in dentistry is not mythical. It is methodical. Dr. Derek Williams here with The Lifestyle Practice, and today I'm going to make a strong claim. If you own a dental practice and you're not making $500,000 a year in income, you're cutting yourself short, but you're actually probably closer than you think. And more importantly, you're probably focused on the wrong things. Not because you're incapable, not because dentistry as a model is broken, not because your market is saturated, but because you aren't focusing on the right things. You haven't properly identified your actual bottlenecks in your practice. You're not consistently pulling the right levers. You're trying to pull all the levers, but not all the levers make the same amount of difference. Today, I'm going to break down the math behind $500,000 in income, the specific levers that really move it, why ownership multiplies your income, and why this level of income should reduce stress and not increase it. And I'll share what this looked like for me personally in my practice. So first, the math is simpler than you think. Let's break it down. If you collect 1.25 million, so about 100,000 a month, at 60% overhead, that's $500,000 in profit. That's it. This is not a fantasy. This isn't a unicorn practice. In my opinion, this should be near the floor for dental practice owners. Averaging 100,000 a month with a reasonable overhead is very achievable. It's not anything special. It doesn't scream overachiever to me. So in my situation, my first year in ownership, we were at about 55% overhead. Decent. Over time, as we became more productive and efficient, we brought that down to around 45%. Not by cutting corners on my dentistry, not by understaffing, but by diagnosing comprehensively, by focusing on the schedule design, by increasing production per day, and by me stepping up my leadership and focusing on that more intentionally. These are areas of focus that led to increased production, efficiency, and lower overhead. And that didn't require increased speed or chaos. It required clarity. Most practice owners think that they have to do more of everything. This is completely wrong. You really need to get clear on what is actually going to move the needle in your practice and focus the majority of your efforts on just that. So now let's talk about the schedule. Here's something that's important. When I was earning almost $1 million in income each year, I was working 23 clinical hours per week. I was working Mondays, 8 to 5 with a 1-hour lunch. Tuesdays, 8 to 5 with a 2-hour lunch where I was able to have a date with my wife in the middle of the day. And then Wednesdays, we worked 8 to 3 with no lunch. So like I said, 23 clinical hours per week, earning almost $1 million a year in income. I was done at 3 p.m. on Wednesday. That was my week. 3 clinical days. I was taking off about 8 weeks per year for a vacation. And every single year of ownership, my stress went down, not up. As my income increased, I had breathing room. My wife and I didn't need to live on a strict budget. We still invested about 80% of our income towards increasing our net worth. Things like student loans, rental properties, brokerage accounts, retirement accounts, and 529s. I was also able to say no more easily. It increased my sense of ownership in my practice. I could dismiss patients who disrespected my team. I could hold my team members accountable. I fired when necessary. So the results of me saying no more, my team members that remained became more loyal. They stepped up their performance. The culture in our office became more fun, actually. We enjoyed working hard together and operating as a team, finding ways to support each other all throughout the day. So the increased income and productivity of my practice didn't create stress. It did the opposite. It created profit margin. And in my situation, that gave me breathing room, which led to a greater sense of ownership. So that's why I reject the idea that increasing your income requires burnout or that it's associated with it. If it does, you're pulling the wrong levers. So now let's get into what are the real levers that you should be focusing on. And this has to do with identifying the bottleneck. Here's my belief. If a competent dental owner, practice owner, is under $500,000 a year in income, it's almost always because they're focused on too many things and they don't understand their true bottlenecks. So like I said, instead of knowing which levers are going to make a difference and focusing on those, they're just trying to pull every lever that they get presented with. They chase marketing, they tweak their supplies back and forth. They're buying new technology constantly, thinking that that's going to really solve things. Adding operatories, they're changing the software on their computers, looking for quick or easy fixes. They might focus on some of the bigger ticket items like case acceptance or schedule or overhead. But because they're constantly looking at all of the levers together, they don't get really dialed in and make actual significant progress. When you don't identify and zero in on your bottleneck, you dilute your effort, and diluted effort gets diluted results. So I'm going to spend a bit of time talking through the consistent top levers that I see. There are occasionally other levers that do become a higher bottleneck than the ones that I'm going to talk through, but these are some of the most frequent ones that I see. So lever number one, case acceptance and diagnosis. You do not need to become this mega implant surgeon doing big cases to hit $500,000 a year in income. You need to stop diagnosing small. Stop being afraid of what the patient is going to think when you tell them that they need $10,000 to $15,000 of work. If it's true that they need it, don't shy away from the conversation that needs to take place. You can be honest and compassionate at the same time. If you find yourself backing off and recommending just one or two things when you know that there's actually a lot more going on, you are the bottleneck in this situation. This points back to your inability to communicate properly with patients. When that's the case, that is where your focus needs to be. When I became confident having conversations with my patients and presenting to them exactly what I would recommend to a family member, my case sizes increased, my confidence continued to increase, and my case acceptance improved. So it's not about complexity. It's not about doing more or less. It is about comprehensiveness. You do not need to be this advanced surgical master to hit $500,000 in income. You need to lead treatment plans confidently. So let's go to lever number two, productivity in your schedule. Let me give you a real example. So last year, I worked with a doctor that was on average producing about $80,000 a month. There was no marketing issue. They had all the patients that they needed. There was no major clinical deficiency. The bottleneck was schedule design. So what we did, we reviewed screenshots of their scheduling system, and we changed the structure for how their staff was scheduling each day. We made adjustments and eliminated the fluff in the schedule. Some of you listening, when you hear me say that, you might be thinking, okay, Derek, well, what was the scheduling system? But you're missing the point. The type of system is not the solution. It's looking at your office and evaluating what's working well and what's not, and then tweaking things. Occasionally, we might need to do a whole revamp, but that's not often the case. A focus on block scheduling might be best, or an emphasis on provider time. Scheduling based on provider time might help more. But in this situation with this dentist, the big ticket items that we focused on and improved were utilizing assistants and operatories more intentionally, grouping procedures properly in appointments, and eliminating unproductive gaps. Just focusing on these things and working on it over and over, week after week, month after month, production increased to $110,000 per month. That's a $30,000 a month increase. That's $360,000 annually. And this was almost 100% profit. We didn't add any expense with team members. There was no new marketing, no new procedures, no changes with insurance. Just focusing on the right bottleneck. Similar to dentistry, you cannot treat a patient until you diagnose exactly what's going on. It's the same when you're figuring out things in your practice. You cannot make a correct treatment plan in your office until you get the diagnosis correct. This alone, in what I'm talking about, this focus here, can push many owners across the $500,000 mark in income. Letter number 3, and what I'm going to call this is decisiveness through increased sense of ownership. Too many new owners dip their toe in, so to speak. They avoid raising fees. They avoid holding their team accountable. They avoid dismissing problem patients. They avoid changing systems. There obviously is a spectrum. There is a balance here. You cannot go in guns blazing, changing everything, but you also can't come in on the other spectrum doing nothing. We've got to find some ground, and a lot of it has to do with understanding your staff and stepping into your leadership. When I bought my practice in 2016, I didn't come in recklessly. I listened to my team and my patients. I respected concerns that they had, and I eased into changes strategically. There were certain things that they were more open to and things that they were less open to, and I had to be aware of that. And it's the same with you in your practice. But I did push where it really mattered, and that was on schedule efficiency, proper diagnosis, production systems, and accountability. Ownership rewards decisiveness. If you step in halfway, you get halfway results. So now let's switch gears a little bit. I want to kind of end talking a little bit about some overall big principles. So what I talked about with $500,000 in income being very attainable for dental practice owners, this should be the foundation. This is the floor. This is not the ceiling. The principles that get you to $500,000 in income are the same principles that get you beyond that to $1 million. The difference is robustness, more refined systems. For every task, there needs to be a person in your office that is responsible for making sure that that is completed. Second, procedure mix. Focus on what you enjoy doing, and that also is the highest profit per unit of your time. Third, stronger delegation. You must be allowing and empowering each employee to work to the fullest of their certification level. Fourth, higher new patient value. Are you marketing for the dentistry that you want to do versus just trying to get more butts in your chairs? So again, these items, the foundation has not changed, which is why I say that $500,000 in income should be the floor for an intentional owner, not the dream. So if you are an owner that is making $400,000 or less and you're feeling stretched, you probably don't need to work harder. You need to identify your bottleneck. And that is what we do inside the lifestyle practice. We look heavily at the production per day, at case acceptance, at the efficiency of your schedule, the procedure mix. We evaluate overhead and profit margin. And almost always when we do that, the solution becomes clear relatively quickly. For some, it's diagnosis. For others, it's scheduling. For others, there's a big focus on leadership and the culture in the office that will allow everything to get where it needs to be. But once you focus on the right thing, the momentum builds quickly. And when $500,000 in income becomes predictable, you get options. You can continue to work more on those systems and build to $1 million in income, or you maintain and you cut back on your time, you enjoy life, you have more freedom, but you are choosing. You're not burning out, you are not merely surviving, you are thriving, and you are choosing the direction and path that you want to take. So again, $500,000 income in dentistry is not mythical, it is methodical. Ownership is the leverage here, but only if you step fully into it. Find the bottleneck, pull the right lever, build profit, protect your life. That is the fastest path. Again, that's what we do at the Lifestyle Practice. Feel free to reach out to any of us, Derek, Matt, or Steve at thelifestylepractice.com.